It's Monday, February 8th, and this is your Barbados Today evening news update. So glad you could join us. Our top story news came this evening that Barbados recorded its 19th death from the coronavirus today. Coordinator of the Health Communication Unit, Ambassador Liz Thompson, announced the development at this evening's COVID-19 update.
The Ministry of Health, and indeed all of Barbados, joins in expressing deepest condolences to the family of a 53-year-old female who had complications from chronic non-communicable diseases and today succumbed to COVID-19.
According to the latest figures from the Ministry of Health, Barbados now has a total of 1,732 confirmed COVID-19 cases. 23 new cases were recorded on Sunday, 9 women and 14 men. 3 of them had already been at the Harrison Point Isolation Facility, and of the remaining 20, 18 are Barbadians and 2 are non-nationals. There were also 27 recoveries, bringing active cases to 287. 1,427 persons have recovered. The Public Health Lab has so far completed 108,286 tests. 46 patients and 21 employees have tested positive for the coronavirus at the Queen Elizabeth Hospital. News of this from top officials from the healthcare facility on Monday, as they insisted that patient care and the safety of staff won't be compromised. Word of this from Executive Director Juliet Bino-Sutherland as she appeared on today's edition of Down to Brass Tacks on Voice of Barbados. In response to concerns raised by Senator Caswell Franklin. Franklin said that nurses were fearful of rising COVID cases at the facility, the lack of personal protective equipment, among other things.
Since January 1st, we've diagnosed about, 46 of the numbers of patients that have contributed to the national number. About 46 of those have actually come from the Queen Elizabeth Hospital. The vast majority are diagnosed through the accident and emergency room, but we also have cases that have been diagnosed in about 7 to 8 different wards, as you would expect, with community spread across the country. Across the hospital.
Bino-Sutherland insisted that the hospital has a plan in place to deal with positive COVID-19 cases once identified.
When a person is found to be COVID positive on the ward, we know that there is a plan. We isolate the patient. We know we need to continue their care for their stroke, for their brain injury, whatever is happening. We continue their care, but we isolate them, and then we have a very specific and well-articulated plan from each department where they are then moved from the Queen Elizabeth Hospital through a pre-designated route to the isolation facility, and sanitization is done of that place or that place where the patient was located, and then in the move at Harrison's Point, Blackman Gollop, and these facilities, we have the appropriate clinical staff who can continue care for COVID as well as the substantive illness that the person has presented.
Meanwhile, government is moving full speed ahead with its rollout of the COVID-19 vaccine. The island is expected to receive 100,000 doses of the AstraZeneca vaccine later this week. Medical Officer of Health from the Sir Winston Scott Polyclinic, Dr. Omar Edwards, told today's COVID-19 press conference the training of personnel is underway.
This is not a public sector only approach. This would include the private sector. This would include volunteer groups. So the training that we have devised will give you a background on the disease COVID-19, a background on the particular variants of concern globally and here in Barbados, a background on the vaccines available, specifics on the vaccine we are looking to introduce here. We are also very cautious that, and the training will include the medical management of the entire process. So this is going to be a thorough training. We're going to cover the vaccine. We're going to cover any adverse effects that may happen. We're going to cover the observation period post-vaccination. We're going to look at the public health situation. We're going to look at the aspects of the logistics, and complete coverage. Every step of the process will be covered in the training.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional happenings, face-to-face classes in Jamaica will remain. That's the word from the country's education minister, despite calls from the Teachers Association to close schools in light of the recent spike in COVID-19 cases.
President of the Jamaica Teachers Association, Jasper Gabriel, called for the immediate closure of all schools conducting face-to-face classes. But Education Minister Favour Williams says, while she notes the call and understands the concerns, there is no need for such an action at this time. Mrs. Williams said with about 20% of schools teaching face-to-face, the ministry is vigilant in doing spot checks in these schools. She said the ministry gets a daily update from the schools, and where there's a COVID-related situation, they're satisfied with how the institutions have handled the cases.
A call to have all our schools that are back face-to-face to cease operating is not one that we are supporting right now. We also watch the COVID numbers. We work very closely with the Ministry of Health and Wellness. We take their directive. And so far, that directive is to diligently and religiously follow the COVID-19 protocols. Our observation is that the schools are abiding by these protocols.
The JTA president also raised issues with the primary exit profile PEP exams, which is to be administered in March. Mr. Gabriel said with many grade 6 students missing classes since March last year, he thinks alternatives should be given so they can advance to the high school level. But Mrs. Williams said the exams will go on as planned.
On the international scene, Western governments support the AstraZeneca COVID-19 vaccination after South Africa halted its rollout when research showed it offered minimal protection against mild infection from a variant spreading there. Despite concerns, the lead investigator on the South African trial of the vaccine said he believes it has a major role to play in combating the virus.
It's been nearly a week since these first shipments of the AstraZeneca vaccine arrived on South African soil. Authorities had hopes that the 1 million doses would tame the pandemic in the country, a crisis that has become even more challenging because of the emergence of a contagious variant which was first detected in South Africa. But findings from research by the University of Witwatersrand and the University of Oxford has thrown the vaccine rollout into disarray. The data showed that the vaccine offers only minimal protection from mild or moderate illness caused by the virus. The news pushed authorities to halt the rollout of AstraZeneca's doses, paying a painful blow.
To me, it's just a disappointment because the only thing MSSC begging much that was going to maybe just set us free, schooling the vaccine.
The B1351 variant is now the most dominant form of the virus in South Africa, a country that has lost over 46,000 people to the disease. Many saw the AstraZeneca vaccine as a saving grace for the continent because it is cheaper, easier to store and to transport. But now authorities in South Africa are back to the drawing board.
We have directed that our scientists must quickly sit together and figure out what approach are we going to use in order to effectively deploy the AstraZeneca. It is temporary until we figure out these issues.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.